Welcome to 10-Minute Clinical Quick Tips, presented by Perio-Implant Advisory. In this series, we present techniques and product demonstrations on real patients, with an emphasis on solving periodontal and implant-related issues.
Hello, my name is Dr. Scott Froum, and today on Perio-Implant Advisory Clinical Tip, we are going to learn about how to correct gum inflammation and bleeding around existing crown and veneer restorations with functional crown lengthening. Let's first discuss the biology of the tooth and its attachment to soft tissue and bone.
There's this thing called biologic width. So the definition of the biologic width is the physiologic dimension of the junctional epithelium and the connective tissue attachment above the level of the alveolar crest. Now, if you look at this diagram, you'll see a sulcus of 0.69 millimeters, an epithelial junction of about 0.97 millimeters, and a connective tissue attachment of about 1.07 millimeters. So you see that the biologic width average is around 2 millimeters. Now, if you add the sulcus to that, you are talking about a 3 millimeter space. Now, this is a 3 millimeter space that can be considered the breathing room of the tooth. Nothing is supposed to encroach on this space. Otherwise, you get inflammation and this invasion of biologic width, which can cause bleeding. If a crown margin is sunk into this space, bleeding can occur around that crown margin because you have invaded the biologic width.
Let's now discuss the etiology of inflammation around existing restorations and veneers.
We have to look at 4 major issues. Does the patient have any systemic factors? Things that would cause bleeding, such as leukemias, immunocompromised diseases. Systemic factors can play a big role in gingival inflammation. We also have to look at the specific tooth anatomy of the crown and the root. Does the tooth have any cemento-enamel projections, cemental tears of the roots, grooves, palatal grooves, things of that nature? That could also cause inflammation. We also have to look at the usual suspects, such as bacteria that can cause gingivitis, or bleeding of the gums, and periodontitis, loss of structure around the teeth. Finally, we have to look at prosthetic issues, and this is what this seminar deals with. Etiology caused by, again, invasion of that biologic width that we talked about, as you can see the slide above, and what it can lead to, which is inflammation and bleeding around the restored tooth, such as the slide on the bottom. And that invasion of biologic width is something that definitely would lead to a bleeding response by the gum tissue.
What are the current procedures for treating inflammation around veneers and restorations?
The treatment of inflammation around a tooth, and especially one with veneers and crowns, really has to do with the etiology. Systemic factors usually require some type of medical intervention. We won't really be talking about tooth anatomy. When we have bacteria that's causing the inflammation, you're really talking about reducing that bacterial load via antibiotics, whether they're systemic, local adjunctive antibiotics, or antibacterial rinses. Mechanical instrumentation, trying to reduce the load of the bacteria, again, is accomplished via scaling and root planing or periodontal surgery. And if there is a prosthetic issue, such as, again, invasion of that biologic width, we are really talking about performing functional crown lengthening, or creating enough of that space between the restorative margin and the alveolar crest in order to create a healthy periodontium.
So let's discuss the steps involved in preparing for functional crown lengthening. The first step is preparing a wax-up.
A good diagnostic wax-up with the final anticipated restorative design will convey a lot of information and aid you in your functional crown lengthening. It will tell you where the anticipated midline is. It will give you information about the gingival levels, especially the zenith of the gingival margins. It will tell you about the incisal edge position and the incisal edge angle. It also will give you information about the interproximal context, as well as the overall morphology or the basic design and shape of the teeth. All of this information taken together will assist you in your functional crown lengthening by letting you know where the osseous crest needs to be in order to create that biologic width and breathing room for your anticipated restorative margins. Other diagnostic steps involved in functional crown lengthening include taking good, accurate probing depths and radiographs. This will really help you determine the prognosis of the teeth. You want to look at the crown to root ratio and see if further removal of tissue is indicated, or will it lead to a poor prognosis because of crown to root ratio. There are alternative options out there, such as extraction and a fixed prosthesis or implant dentistry. These are all things that should be reviewed prior to surgery. The other thing you want to look at is tissue type. How much keratinized tissue you have versus how much mucosa you have. This may determine your surgical flap design. If you have enough keratinized tissue, you may consider gingivectomies. If you do not, you want to increase keratinized tissue, you're maybe thinking about apically positioning flaps.
So let's tie all this information together by looking at a case example and a surgery.
So let's take a look now at a case example of a 34-year-old female patient with a non-contributory medical history. She had veneers placed on 5 through 12 about 10 years ago, and ever since she's complained of gingival bleeding and inflammation. Her gums, quote unquote, never fairly felt right. She's complained of bad breath. And my diagnosis was that she had invasion of biologic width, and that because of the veneers that placed, her body responded in a negative way. So the way we're going to treat this case is we're going to use a 9.3 micron laser from Solea, and we're going to do both functional soft tissue and hard tissue removal in a closed flap manner. The intention of this procedure is to really reduce postoperative pain by not having to use tremendous incisions and sutures. So this is the Solea machine, the 9.3 micron CO2 laser, and as you can see here, we are beginning to do our functional crown lengthening with an ultra guide handpiece, which is a insert into the laser hollow wavelength tube, and it helps us perform both soft and hard tissue crown lengthening. And as you can see here, we are making sweeping motions with that hollow wavelength guide in a closed flap manner, reducing the soft tissue architecture, creating positive architecture of both the bone and the soft tissue. We use this in a way so that we create that biologic width that we talked about, that 2 to 3 millimeter space below the crown or veneer restorations. You can see here the margins of the restorations and a space that we're creating in order for the body to have that type of breathing room. This is done, as I said, with this laser in a closed flap manner, which is nice because you can see that the bleeding is very minimal. In addition, the water spray to this laser not only cools the area to prevent thermal increases of the tooth, leading to pulpal necrosis, but it also is able to wash away and clear the field, which is very nice. Now you can see here, I have a nice architecture, and the case is then finished and given 2 weeks to heal. And here is the case at 3 months post crown lengthening. You can see a nice resolution of the inflammation of the tissue, a nice tissue tone. Although you can see some loss of a papilla that is to be expected, this patient is scheduled to get new restoration and new veneers around her teeth. If you take a look at the before and after, you can again see inflammation from the invasion of biologic width in the before shot, and after, again, a nice tissue tone whereby the tissue will accept new crown restorations and new veneers restorations with that nice biologic width created. So in the remaining minute, let's summarize what we have learned today in our clinical tip. We learned about the invasion of biologic width and how there is a space that is needed before any crown restoration or veneer. We learned that when we invade this space, we can get a bleeding response. We learned about the need to treat invasion of biologic width with functional crown lengthening or recreation of that space in order to maintain a healthy periodontium when placing prosthetic restorations. We learned that one of the aids in crown lengthening is a diagnostic wax-up, which conveys much of the restorative information needed to perform your surgery. Finally, we learned how a Solea 9.3 micron laser, the CO2 laser, is one of the ways that we can treat and aid biologic width recreation through functional crown lengthening. This is done in a closed flap manner with both hard and soft tissue removal to recreate that healthy space needed for prosthetic restorations.
For more information, contact Convergent Dental at 1-800-880-8589 or visit info@convergentdental.com.